In the management of acute ischemic stroke, there is a dichotomous reaction from the medical community towards high blood pressures. On the one hand, while we do prefer that the patient has elevated blood pressures during an acute onset of stroke, we often get antsy and agitated if the person has blood pressure that is too high. So we like high blood pressures, but we get scared if the patient's blood pressure is higher than just high. In acute ischemic stroke, there is an infarction ongoing in a certain region of the brain. And this is why we give thrombolytics to break down the clot so as to redeem the redeemable tissues. When a person's blood pressure is low, the cerebral perfusion pressure would also be low, and hence the rate of redemption of the ischemic penumbra is low as well. So we would typically prefer, if the patient has blood pressures that are higher, let's say above 130, 140, even up to 150, we do not give antihypertensives to patients with high blood pressures if they were to present with acute ischemic stroke, because it would help in redeeming or reperfusing the ischemic penumbra. However, if the person's blood pressure goes beyond 180, if their systolic blood pressure is beyond 180 and the diastolic blood pressure is beyond 110, this would paint a whole different picture. It not only tells us that the cause of this patient's stroke might not at all be an infarction, rather it could be hemorrhagic stroke for which thrombolytic therapy is contraindicated. But persistently high blood pressures at these levels also could lead to intracranial hemorrhage should we administer thrombolytic therapies. So yes, high blood pressures could be very helpful in reperfusing the ischemic penumbra, but too high pressures beyond 180 by 110, could increase the rate of bleeding, could increase the chances of the person developing hemorrhage, and thus increase their mortality rate.